Good morning, everyone. Thank you for joining us for a Zoom budget hearing. This is day 2 of our budget hearings. Our first group this morning are our youth services organizations that we've asked to come talk to us kind of as a whole. For those of you that might not have participated last year in this hearing, we generally structure these hearings where it's really both a conversation about your budget, but then also just sort of the status and state of affairs in this area right now. And we have approximately 45 minutes for this budget hearing, but we need to reserve some time for the supplemental request related to the Children's Advocacy Center. The commissioners will continue to have deliberations on the rest of the budget tomorrow and into next week. And then we'll be determining the final budget for 2021 either later next week or early the week after that. So our kind of deadline's mid-July. So I don't know if anybody particularly wants to go first and talk a little bit about youth issues or concerns you're having in your organizations.
Well, I can go ahead and start if you'd like. The biggest issue, obviously, for us, we're coming forward is school and how that's going to play out in terms of the day school and attendance. Also, that's going to impact potentially our truancy program as we determine how school is going to look moving forward and how we'll be able to do any kind of face-to-face or advocacy work with kids in the truancy program. As you may know, the detention center population right now is 7, and we've been really fortunate that we've had no COVID cases at all. But we're really following pretty stringent protocol. Staff wear masks all the time. We temperature check. We have not had any volunteers or visitors in the building at all, probably since April or May. We do Zoom calls, and we do a lot of counseling over Zoom and things like that to try and have people see their kids face-to-face and see their clients face-to-face via Zoom. But we've been really limiting who can come in the building. We are now doing fingerprinting for local agencies by appointment only. I believe the sheriff's office is doing the same. But we still do the temperature check and the COVID questions with anybody entering the building for any purpose. Those are kind of probably the similar things people are facing everywhere else.
I think for us over at Van Gogh, you know, and certainly as Pam was saying, I think with, you know, COVID-19 pandemic, you know, certainly seems to be impacting the most vulnerable populations the hardest. And so all of the barriers that we typically see for the youth in our population have become more pronounced. And you know, we've looked at their learning disrupted, their employment disrupted. We've seen, you know, income disrupted for both the youth and their families. And I think the uncertainty of it all is, and the inability to plan and know what's coming next and set goals and know what to anticipate in terms of school and then when even some of their very basic needs are uncertain and having those needs met uncertain has really impacted mental health significantly. So we have seen an increase in the need to support our population as well as their families with additional mental health supports. We've been doing a lot of telemental health. We've been doing a lot of virtual and remote engagement over the last several months and to keep connected with our population and support them and mobilize resources. The Human Services Coalition call has been tremendous in providing information to us that we can get out to our participants and their families so that they know where to go, when, and we've even been able to also serve as a proxy to pick up food and deliver it to our participants and their families, which has been tremendously helpful. And then we too have resumed on-site programming for the summer in limited numbers. And we have 12 on site, and we are using every single inch of our facility. And we're doing all the same kind of health and safety protocols that Pam described in terms of physical distancing. We're saying physical distancing rather than social distancing. And everybody's wearing masks. We're doing a check-in procedure as they come in. We have a sanitizing procedure at the end. So I think also for our agency, you know, trying to find ways to absorb the cost of the additional personal protective equipment and sanitizing services to be able to do things on site has been a little bit more challenging for us as well. So those are some of the things that I'm sure are common with all of us, but that's kind of what we're seeing on our end. Thank you.
Hello. So, oh, sorry. Go ahead. Okay. So this is Eric with CASA. So this is my first time participating in this hearing. So it would have been Diana before. So thank you for having me. So I think, yeah, I think all of those things have already been mentioned are definitely challenges for us as well. I think some of the things that my staff and I have seen specific for CASA has been lack of placements for kids. That's always been an issue. However, I think there are fewer people deciding to be foster parents at this time. And then just there's been lots of programming changes within PRTF's psychiatric residential treatment facilities within the state. And it is a little bit unrealistic to ask for there's going to be a specific placement in a PRTF for every kid and each unique need that child has. But we've just seen there are more cases that are just unique and challenging and complex, and it's very difficult to find placements that are good for them. It's kind of just it'll keep them safe where they're at right now, but it's not very therapeutic, nor does it really help them meet the goals that they need in relation, or you know, when it comes to emotional wellness or physical wellness or educationally. So that continues to be a challenge. And then similar to not having people coming to become foster parents or placements, volunteers have been a challenge. So we are going to be heavily recruiting over the next year. I hope we'll find volunteers, but it's been a bit of a struggle. People come to be a volunteer so they can have that direct contact with kids, and due to COVID, although they can have phone calls and video calls and those types of things, they're only on limited basis are people seeing kids face to face. And so that's a challenge. And so we're the cheerleaders trying to get people to see you're in this for the long term. Remember that we said cases last about 3 years, if not longer. So just trying to get people to focus on the long term and the benefit of long-term advocacy for the kids in the child welfare system. So, and then we're trying to gear up and get prepared for, we just anticipate there's going to be ongoing increased need for just basic necessities for families and the kids. So that's food, supplies for activities, education activities, as well as, you know, just things for kids to play with, because kids learn by playing. And then clothing, and lots of that is obviously due to the economic impact of COVID, but then there's also been a change in the way that foster parents have been paid, where they used to receive a quarterly payment that was specific for clothing, and now they receive that payment directly, and that clothing piece is just lumped into their daily rate, and that's not been clear, and we anticipate that many foster homes are not setting aside those dollars for clothing, and we anticipate there's going to be an increase in requests for clothing especially when we hit the school year and change in season. So I think those are the things that we're gearing up for and have seen.
This is Joyce DeBolt, and I'm with the Children's Shelter, and this is my first hearing, so this is not usually what I wear. However, Judy Culley, our previous ED and our consultant at this time, is sitting in the same room with me. So that would be why I'm sporting this nice little shield. But what we've been working on is pretty much echoing what Pam and Eric and Kristen have said, and working with our clients, our office, we're keeping staggering schedules and offering families to come on site with the screening process in place and providing them masks if needed. As far as client work, we're doing some sidewalk visits. We also provide Zoom calls and all of those needs to touch base with our families every day to help them. And I think, you know, Erin Harmon, I'll let her speak more to a lot of the larger needs, but we have been wearing masks and doing all the PPE within our residential as well as within our office, and just trying to meet the needs of families, seeing the same struggles everybody else is, and keeping our houses at 50% capacity in order to keep the physical distancing reliable, but then also to make room for any police protective custody placements. So I'm going to let Erin speak more to the specific needs of the families that she's been working with.
Hi guys. So in prevention programs, we see the high school truancy kiddos, and that's echoing Pam big time. We're not sure what's going to happen with school, so we're just kind of flying at the seat of our pants at this point. But we're hoping that whatever the school district comes up with, we will, you know, make accommodations for, make sure these kids, because some of them within our, actually both truancy and specialized, they really rely on us as support systems and case managers. I think that they're kind of a population that sometimes doesn't fall in the mental health or doesn't fall in some of the other categories where they would get those supports. So it's really been good for them to have us doing Zoom, doing phone calls, doing check-ins throughout all of this, to make sure they know that someone's still here, irregardless of whether school is in session or not. So, but yeah, I think we're gearing up. I know the city of Lawrence also gives us financial assistance for resource management. So we're gearing up for some of those needs that you guys are talking about, for rental assistance, utilities, those kind of things for our clients, and just community members in general for Lawrence, because they are now that they don't have the ability to wait on rent or wait on utility payments and those kind of things, we're starting to see numbers increase on back payments that, you know, Westar or whoever needs or wants at this point. So we're just kind of preparing, also trying to help calm our kids with not knowing what school's going to look like, not knowing how, you know, families, parents, how they're going to go back to work, all of those things, and have kids at school. So, but I think we're prepared and we'll get through it like everyone else. So thanks, guys.
And just probably on that note, what I want to say and to end is just thank you, Douglas County, for all the support that you've given us to help families and children, because it's huge. And we really appreciate the opportunity to work alongside you with the mission statement that we have to improve the lives of children and families. So thank you.
Here at Douglas County Legal Aid, we're based at KU, so we're dealing with all of the budget changes and will we be back in the fall or not back in the fall issues that KU is dealing with. We work through law students usually who are staffing our cases. They're not here this summer, so Professor Schnug and I are handling all of the cases here while the law students are gone. So our staffing has changed a little bit. We have not had, so for the kids that we do have that we're representing right now, we have pretty regular contact with them, and we're working their cases through the system as the courts are starting to open back up and trying to find resolutions for them. In many ways, we don't have the same opportunities we had in the past to show that a child is doing better at school or better at a BGC program over the summer. So our negotiating leverage with the DA's office is not as good because we don't have that positive progress to show for kids that are trying to work out a favorable plea, but they've been pretty flexible. And then we have not seen, because most of our sources of cases of children getting charged with crimes originate in schools or at Boys and Girls Club or in group settings where adults will call the authorities on a child. We're not seeing as many of those, and the kids aren't congregating at the pool and getting into fights. So it's slowed down a little bit in the last couple months because kids just aren't out there. I don't know if Aaron and others are seeing as much of that as well, but there's just not as much friction with adult authority figures out there in the world that we're catching up on. I'll be interested to see what happens over the next couple of weeks with the protests downtown, and I've seen a lot of my former clients down there. So it'll be interesting to see who ends up working their way back into the juvenile justice system over the next couple of weeks. So as far as the families, they're going through the same things that you all have already so articulately described that's going on for everyone in the county right now with children. I don't know how things will change as people get more restless over the summer and get out there to escape the heat or do whatever. So we'll see how our caseload changes. The other issue that I'm very concerned about, I think, as Eric mentioned from CASA and also the folks at the shelter, is our kids in group homes. They're not having the same kind of visits and human contact with stable adults that can reach out to them that they once had. My kids who are in group homes or shelters or even independent living are not seeing their families. So all that progress they might have on a reunification goal is not progressing. It took a long time to get Zoom therapy set up for some of them. So I'm concerned about those things. I know that the folks in those placements are doing the best they can with what they have, but it's really affecting those kids who have been in the foster system for a really long time to not have the opportunity to make progress and show progress, which is what we see from the kids in the juvenile justice system too. So that's kind of how this long pause on normal interactions for kids is affecting those kids in the dual status and the juvenile justice system. We're not seeing any change in a need for resources here. We can cover what we need to cover without the law students here, and we're modeling what will happen when they come back as far as ways to either do fully remote or hybrid versions of working with clients. And there's a lot in the legal community percolating on how to do that. So.
Hi, I'm Becky Price with the Ballard Center, but I'm representing a group that is forming or working to form a child advocacy center. And I can say ditto to what most everybody's seeing. I think that the need for the child advocacy center, we all know, is higher than ever with COVID because there is no mandated reporters. The kids aren't at school. So that there's a 50% decrease in reports, but we all know that statistically the abuse is much higher. Just in Ballard with our early childhood education center, we were really lucky that during COVID when we were closed, we were still able to get eyes on our kids. And most the school district was not able. I've made 3 reports to DCF this week. And it's been that way since we got back. Thank goodness we have a therapist and we hired a new social and emotional staff person to help us because we knew what was going to happen when the kids did come back on June 1st. And that's just Ballard Center, a teeny portion in Douglas County. I think also with the Child Advocacy Center at this time, since there's no mandated, there's not eyes on the kids, it's a lot less scary for a family member or a neighbor who suspects abuse to call a child advocacy center and take the children to a child-friendly space, then try and navigate then taking them to the police station or DCF. And I think that it's just a lot less intimidating. And I'll tell you, I've been a mandated reporter my entire career, and I'm old. And it's complicated for me every time to figure out, okay, wait a minute, you have to make a call now or to get to the website. And for families who do not have the technology or the knowledge, calling a phone number and getting a voice would just be a lot less scary, but this is a scary time.
So I don't know if we want to just continue to ask Becky questions about the supplemental request, or if there's, before we do that, if commissioners have questions of other agencies, before we do that. I think one of the things that I would say of other agencies is we, how we, one of the questions that we always ask ourselves here is, some of this is, we're going to be under COVID and Corona considerations for a period of time. So if they're, how do we sort of change the way we do things in order to try to make sure that people aren't falling through the cracks? I think Melanie's right to some extent that, like, I don't think the notion of everybody staying home and not is going to continue. I think we're going to have more issues with folks not quite sure how to act in the new system, where they may not be in school necessarily, but it's going to, they might be out in the community more. And how do we make sure that in our intent to keep everyone safe, we haven't excluded some folks that might fall through the cracks?
Well, so with every presentation, of course, my mind keeps going back to our CARES, the Spark money for COVID-related costs, and I, the list is growing awfully long in terms of all the different organizations that have borne a huge cost, but it just underscores again for me the need to really understand that program and what the parameters are, and so we can start to think about what that list of recipients really can look like, because it's just growing longer and longer. But it's just it's a lot. But is this group of organizations are you all part of that consortium of human services agencies that meet regularly? And so the collaboration is already underway in the sense of what each agency can do for each other. Is that already a strong network, or is everybody in that?
I would say that between, folks in this group could either be represented on the Housing and Human Services group or education, depending on specifically their role. So, I think both of those could potentially serve either. I think with what we are hearing for the CARES Act is it needs to be tied to COVID. So the ties have got to be real strong. And the closer the tie to direct COVID response and recovery, the more likely it is by the state to get approved. And so I think one of those things that, if there were a program that a community partner were to create that might be able to reach youth in a different way, that because of now with COVID they can't, I think those kinds of things could be successful, but day-to-day operations, ongoing operations is probably not the kind of thing that could be supported.
This is Joyce, and I think I just want to echo in there about accessibility, making sure that we're accessible, and that's what the Human Service Coalition has really helped us to gather ideas and to work together. And then there's a subgroup for congregate care that has been extremely beneficial, as well as the Unified Command. I mean, they have been so supportive in our day-to-day, but you're right, Sarah, as far as accessibility in a different way, and Erin has done a really good job figuring that out. to make sure that families have access to us, whether we're here, whether they can come here. And that's been a huge challenge, but yet we've rose to that. And I would say most agencies have here and continue to collaborate, share resources, and work together. So it definitely is a work in progress. So I just wanted to throw that in there.
I would ditto that. And so Eric, Ballard has lots of clothes right now. We will be able to, for sure, get the kids clothes. We're not accepting donations, but they're coming in. And if we put out, we need kids clothes, we get truckloads. So please, we're doing it by appointment only. But if you have, please let your foster parents know that we've got plenty of kids clothes, and they're some pretty nice ones.
We have maybe we should continue to talk a little bit about the CAC request. Becky, I don't know if you had additional information you wanted to talk to us about with the request. One of the questions I had was, in other CACs, is their funding normally 100% local government? Or I think the commission has concerns about starting a new organization that is 100% dependent on the county.
Right, and we typically, we're applying for a grant. We've applied for a couple of federal grants, and we're applying for, and it's not the VAWA, it's the Victims of Crime.
VOCA.
Yes, we're applying for that. And so typically we wouldn't have, the community should support 50% of it, whether that's through donations or the county. In my experience, it's just been that if your community does not own, is not invested in the nonprofit, that it's not going to be successful, because federal grants come and go and state grants come and go. But I think that we plan on doing, well, everything's kind of changed because of COVID, but getting individual donors to support it. And I've got a list of 5 different grants that I'm applying for to kind of get it started. So we're just kind of working towards that.
And I see that you have a from the city of Lawrence. Has that been, is that confirmed, or?
No, they haven't opened their application up yet. I mean, I think that COVID has hit. They keep delaying when you can apply for city funds. I hope my staff members kept up on that, but it hasn't been. The application process isn't open yet. I did meet with Brad Finkeldye, and we've met with the city commissioners, and I think that they're all supportive, and I think that my hope is that they will support it as well.
Becky, I was interested in hearing more kind of what you're beginning to talk about. Who are the other community partners in this? And I'm especially interested in like the Lawrence Police Department, or those folks in the criminal justice system that would need to be involved, and kind of what's the breadth and depth of the coalition so far?
So we have met with dozens of different advocates. We've done a needs assessment and a feasibility. We have the MOU that we're partnering with Burton Ash, and the CEO has signed that. We're partnering with the Sexual Assault and Trauma Care Center, Willow. We've had a little bit of challenge with the police department signing the MOU because their police chief switched, but we have that secured. We've met with the forensic interviewers with the police department and Captain Adam Heffley, and so they're all on board. We have a meeting, and again, Ken McGovern was all on board, but now we have a meeting with the new and I'm sorry, the meeting's tomorrow and I don't remember the interim's name. The DA has signed and is on board. The superintendent of the schools isn't on the MOU, a part of the multidisciplinary team, but he is really on board. He's actually one that, before we even thought about doing Child Advocacy Center, was visiting Ballard and said, why don't you have a Child Advocacy Center here? So and I think that Eric can agree that I think that all of the nonprofits, the directors are in the community would love to see a Child Advocacy Center.
And then I know this is in the packet and certainly in meeting that I had with you and Judge Martin, but could you, just for the sake of kind of the public record and everyone's hearing it, what do you see as the current disadvantage of the system as it meets kids' needs right now?
Well, I think that a lot of it is just the wraparound services that are needed. It starts with, kind of like I said, with when somebody suspects abuse. If you're a teacher or a mandated reporter, you know who to call and what to do. It's just a lot less intimidating to go to a child-friendly space to make the report. And the main part of the multidisciplinary team and a Child Advocacy Center is that you have somebody that is coordinating all the efforts. So it takes something off the shoulder of the DCF and law enforcement. Somebody that is making sure that the family gets the support they need, whether that's a place to stay if it was included domestic violence and the mom needs to get out with the child, or whether that's therapy for the child or for the non-offending caregiver. So I think that there's just a lot of ways that it makes it so much easier. There's lots of statistics and lots of numbers that show prosecution is better. It just takes the weight off of law enforcement and DCF and other agencies, because everybody's collaborating and working together to work to take care of the needs of that child, which can be different for each of them. We have the group that's really working on it. So Went Winters and Paula Martin, and they're all out there, but they can't get on to speak, and they can speak better than I at this. The doctor, Jennifer Hansen, who is does the intakes at Children's Mercy Hospital, which is where the kids go for if they need a forensic exam. And statistically in Douglas County, the percent of kids that get the forensic medical exam is really low. And I might quote this wrong, but I think in 18 months, we had 9 kids get the forensic exam in Douglas County, as compared to like Leavenworth, which is another community smaller than Lawrence, but about the same size, that they had over 100. They're not, the law enforcement or DCF might refer the kids, the parents, and suggest they go and get a medical exam. But it's when you're in the middle of everything, when your life is turned upside down and somebody said, here, how about you drive to Kansas City, figure out how to park, figure out how to make an appointment, and go into the hospital and have this exam. And here's a list of therapists, because you probably should get some help. So some of that's a lot of the changes. And it's the Child Advocacy Center. The best part of it is that it's a national organization in all communities. But Lawrence is one of the very few that doesn't have it. And we have the support of the Kansas Child Advocacy Center. And all of the directors of the Child Advocacy Centers around us are very supportive. The director, Julian, is of Kansas Child Advocacy Center, has helped us with writing grants and with coming up with the MOU and helping us identify the quickest way to get accredited with the national office.
I saw in your materials that you added that a couple of the Kansas CACs have strong relationships with CASA. organizations. And maybe since we have Eric on the call, and if you're present, you can be subpoenaed. If you could talk a little bit about, is that a model that could be, why would it be separate from CASA in this community?
Well, I'll let Eric speak to that. When we first started talking about it, though, we got together with all the directors, and it's, if the sexual assault or the domestic violence or the CASA is very common. And Eric, I'll let him answer at that point. He just didn't.
Well, so yeah, I mean, the answer to that is we were approached and asked if we wanted to take it on, and we're at the position with our mission of wanting to increase CASA in the community and focus on that rather than take on a CAC as well. So we're focusing on trying to make sure that we increase our capacity to serve every kid that needs a CASA in the community first. And so we are 100% supportive of what the Ballard Center is doing and starting a CAC, because we do see the need for that within the community. But my board wasn't supportive of us being the entity that takes that on in this community at this point. So thanks to the Ballard Center and Becky and those other folks for taking that on, because it really is needed in the community. And I think when, I don't know the exact numbers, but not all communities with CAC and a CASA program, they're not always in the same agency, but it's kind of up to that community and the partners that want to put that together. But it is a good, I think, model. It does work well when community decides to do it that way. And then I guess since we're talking about it, we also had the Douglas County Child Abuse Prevention Task Force. We've talked about this multiple times, and that task force is supportive of these efforts as well. And I think that, well, lots of the partners that are on here are around that table as well. But once we get to meeting again after all this COVID stuff, then I mean that group stands ready, I think, to support the efforts as well. And honestly, when that task force started, that was the purpose of that task force, is to kind of really look at getting from what my understanding is, to get a CAC started. So I think folks are really excited to see this moving forward.
I think also, to be clear, that it's even if the Child Advocacy Center is under the umbrella or collaborating with the CASAs, they're still a separate entity, and they will be. So it's not going to be the Ballard Child Advocacy Center. It's the Douglas County Child Advocacy Center. And we're not even sure yet where it'll be housed, or, I mean, we're still working on all the details of that.
Yeah, the only reason why I mention is just that, sometimes just when it comes to like managing a storefront and, fund balance and all the things that you would need if you're going to be a totally separate, independent organization, sometimes sometimes it's better to be an outgrowth or, be kind of incubated someplace and get your feet underneath you and then kind of see how it goes, as opposed to putting all sorts of costs into sunk costs. It's just a possibility for you all to continue to explore and consider.
Yep, and that's absolutely what we're doing. We're still just at the early stages, although we've done a lot more than I thought was possible. But I do think that it's because Ballard does the wraparound services, which is so much a part of the advocacy that's connected to a Child Advocacy Center, that we have staff that's been helpful in helping us get going. And we will absolutely partner. We've had meetings before with CASA and with Christy with the Sexual Assault Care Center, and Megan with the Willow, and they're all, we've discussed how can we use your therapist, and how can we kind of piece this together with Bert Nash, their new director of Child and Family Services. Judy is amazing, and she's very familiar with, she's been on the multidisciplinary team of a Child Advocacy Centers. So there's lots of ways that we'll partner, and it would just be if we could get a staff member to help just kind of pull everything together.
Mhm.
Becky, you know, it always, I guess, saddens me when these kids who are already traumatized are having to, you know, get into a system where they're having to relive that, or they're being moved here and there and back and forth. And when you really just want to be able to put them in a safe place and have everybody else come to them and minimize the number of times they have to relive their story or what the event. So I'm kind of curious. I mean, I always like to look for, in the same way, efficiencies where the partner organizations can maybe create some efficiencies and more of a one-stop shop, have all those people together. But I do have a question. So in the handout, it said that Lawrence is the largest city in Kansas without a CAC. Do you know what it looks like, say, in Overland Park? Is it a Johnson County as a whole, or is it the city of Overland Park? Because that's a pretty big city.
It is Johnson County, and a lot of staff have, hey, Jeff, sorry, I'm so sorry.
It's Sunflower House in
Yes,
Johnson
thank you,
County.
Jill.
Sunflower House in Johnson County, and then in Casey Mo, it's the Children's Place, which both organizations have been around for a pretty long time, yeah, not-for-profit organizations. So that's probably what Dr. Lewis was familiar working with in Kansas City, yeah.
Okay, I'm familiar with the Children's Place. I wasn't familiar with the Sunflower House. Is that what you said, Jill?
Yeah.
Okay. All right. So,
Dr. Jennifer Hanson just walked in because she can answer questions way better than me.
Well, I know that we're kind of on a time limit.
I know. All right.
But
all right.
I really think the public discussion of this, especially in a setting like this where it can be discussed with the three commissioners, I would really like to continue this conversation. Unfortunately, in this setting, we're on a time limit.
Right.
But yeah, thanks to all of you for, I know that everything you do every day is so challenging, and it's hard to hear about what's going on with COVID. And these kids are losing that human contact and touch and accessibility maybe to their support system that they need, because we have to look at their safety now on the health issue of COVID. But thank you for that, and thanks for being here today, and keep up the great work.
Can I just, I know we are on a tight time crunch, but I think if Dr. Hanson made a special effort to get in a place where she could say a word, would you all be okay if we allow her to, just if shortly, but kind of get to the nugget of what you would have wanted to say?
I was on the call, and so I heard Becky did a great job sort of explaining it all. I come from a place though where we work with lots of communities and see how the multidisciplinary team functions in multiple communities. And by far, child abuse evaluations from the start work better in communities where there are child advocacy centers. And our law enforcement partners here in Douglas County and DCF do a great job, but the wraparound services that sort of surround these families from the time that the investigation starts through the end of it are really what makes a difference for the investigations as a whole. We are more likely to get prosecutions, kids are more likely to get medical evaluations and therapies, and families are more likely to engage with the investigation services and with the community support services to make them successful, to make our kids successful so that they can grow up to be successful contributing members of society.
Thank you.
The one thing I wanted to add as well is, this project, I have a lot, I'm very supportive of this project, but I also think in some of the questions that have come up and some of the things that Becky's talked about in terms of the conversations with stakeholders and bringing in the different partners, in particular from law enforcement and the criminal justice system, I do think that there's some significant adaptive challenges that we have to work through And I know Becky was working through that pre-COVID, setting up those meetings, and was really, really responsive to some of the discussions that Becky and Pam and I had. And even we had some really productive conversations with Jackie Zenson from the DCF office. And we had some plans to have some good, public facing meetings to try to talk a little bit more about some of the adaptive challenges that we need to address to be successful with the CAC model. So I just wanted to offer that in because, again, I'm nothing but supportive of this proposal, but I do think there's some significant adaptive challenges that we need to get through, and I think we can get through. We're doing it already with the adult population, and yeah, the COVID just really stalled this out in a lot of ways. Where we were at, the last meeting I had was with Dr. Hansen's colleague from Children's Mercy, talking more about this issue and trying to understand how we can smooth that through those adaptive challenges through our partners in the criminal justice system.
And we have had more meetings with them and have come up with some creative solutions with them since then to figure out how we can move forward initially.
And the DCF has signed the MOU, and the legal departments of the police, DCF, Bert Nash. My legal department has reviewed the MOU as well. So we've secured the signatures, but we do have challenges to continue.
Well, maybe, and I would certainly be glad to schedule a work session on the CAC later this summer, as soon as we can kind of get everybody's calendars coordinated and get you on the calendar to further explore it and go into more detail. So I've written that down to contact Becky and make that happen. One of the things I would ask then, particularly as Jill and Pam have been engaged in this work on behalf of the county, my concerns here are almost purely administrative and financial, and structural. So while I know, Becky, that federal and state grants come and go, they're important signals that there is a level, governmental level support for the work. And as you all read a lot, that the county is under a lot of concerns that, do we have too many nonprofits? And so I just think, and how do we do that? So I just ask that we try to be very conscious as to how do we set this up and that structure in this environment where, I think there's also a large group of folks who feel like, is everything well coordinated? And if an agency is 100% dependent on the county, is it best that it be separate from the county? So I think it's some of those things that I'm going to ask you guys to think through as this project evolves and matures.
Sarah, if I could just jump in. I apologize, everybody. I'm having terrible internet, so I'm jumping in and out all morning. So I'm trying to keep up, and I will definitely watch the recording. But I would really appreciate a study session on this to understand more about it. I'm interested in what we're doing now and how the Child Advocacy Center will change what we're doing now. Where are the things that are happening now that will go away because we have the Child Advocacy Center, so that we can, align, that constant alignment of services. Is something I want to understand more about. What is DCF doing? What is Bert Nash doing? What is CASA doing? That's the purpose of this group coming together. So I think it's great that it came to this group and that Jill and Pam are involved in it. But I'm hoping we can have a bit of a deeper conversation. This is our first pass at this. And I think we need a deeper conversation to understand about how it affects the entire system.
We would love to have that opportunity, and anytime, let us know, and I'll have the people that can answer the questions better.
Okay, so unless there are other questions, I'm not seeing any. We probably should move on to our next. I think we want to give a small break here, just if Commissioner Kelly wants to try to reboot his internet. So maybe we could, I apologize to the folks in the land and animal services, and we can move them into the group while we do this change. But if we could take a small 5-minute break, that would be great.
Thank
Thank
you all for your time.
Thank you all.
Thank you.
Thank